All right. This is dental emergencies. Okay? Oh, yes, I can 100% make it better. Bigger.
Bigger, better.
Bigger, better.
What?
Don't be like that.
All right, not on the test. But basically, we treat sick call like you guys treat sick call. Honestly, it's the one thing I hate is dental, is sick call, because it's people that have waited forever and a day on something that they've probably had issue for months, and now try to make it an emergency for us. Coming at 1600 on the end of the day, or I have 5 people lined up at 08 on a Monday. It's not fun. All right. So the thing you need to know is recording emergency treatment. Okay. This is actually wrong. No, it's right. Never mind. It's right. On the Z603A. So, emergency treatment is recorded on this form. What is this form? Dental treatment form. There's also another treatment form. I'm not going to get in the weeds about it, but if there's somebody that doesn't have a record, there's actually a specialized form that we have for like dental sick call. It's like a shadow form, I guess you would say. We fill it all out and they give it to them to where they can go then put it back in their record. Diseases of the tissue or the tooth. So we've learned about some of these.
Dental caries, chalky white spots.
Chalky white spots, dental caries. I wanted to nerd out on y'all a little earlier, but I'm going to show you how teeth work, right? So, anybody heard about fluoride in the water? All right, so your tooth is made up of a bunch of organic and inorganic materials, all right? That's why it's one of the hardest substance in the body. It's just a bunch of materials melded together. Those main materials are calcium and fluoride. Fluoride is what strengthens your teeth. That's why fluoride's in your toothpaste. It's in your mouthwash. That is what keeps your teeth strong. Now, there's a such thing as too much fluoride too. You'll notice that if somebody has too much fluoride in their water, that they'll have a certain discoloration to their teeth. Right? So what happens is the more food and gunk and debris that you leave in between your teeth or on your teeth, if you let it sit there, because let's ask a question here. What are and no lab techs answer this, because I know you guys know the answer. What are the 4 growth requirements for bacteria? I'll give you the term MONT. So moisture, temperature, oxygen, nutrition. Okay, so I want you all to think of the mouth for a minute. Okay? Is our mouth wet? Do we breathe oxygen? Do we breathe oxygen out of our mouth?
We do.
Okay? Is our mouth warm?
Yeah,
Nutrition. Do we sometimes have food and gunk in our mouth? We have the incubator for bacteria sitting in our mouth. Okay? And now think of that if you're at night going to bed, and for 7 or 8 hours, and you left food in your mouth, you are letting bacteria continually grow. You didn't brush your teeth before you went to bed. Grow in your mouth overnight, which meaning it's going to stick to your teeth more, harder to clean off the next day, and it's going to start slowly breaking down that tooth. Right? So, we have to constantly fight that with brushing and flossing, because anything that you leave in there is just slowly going to cause a decay process. And that's what happens, is leaving all that gunk there slowly breaks down the calcium deposits in your tooth, causing this chalky white spots, which eventually turns into, well, it starts as an incipient and then turns into a cavity. Does that make sense to y'all?
Bacteria parts throughout your teeth.
But yes, or you're like me, and not to get like personal, but I actually got diagnosed with it a couple years ago. I have chronic paranasal sinusitis. It means basically I can only breathe through my mouth. I'm always clogged through my nose. So if I'm a mouth breather, if you know a lot of people are a mouth breather, you're even more susceptible to bacteria building up in your mouth. So you have to be more apt to making sure that you're brushing at least twice a day. If I recommend it and you guys kind of suck at brushing your teeth, I would do it at least before you go to bed and when you wake up in the morning. And floss at the same time. Okay? That's how you keep your teeth, because that is the only bone that you can't grow back. Once you lose your teeth, they're gone. So that's why you see people with grills and fake teeth and metal all in their mouth, because you can't grow that tooth back. Unless you're rich and you can buy a bunch of veneers to put in your mouth. All right. So this is what they like to throw on the test, the treatments here. Okay? These are the ones where they love scenarios for dental. Alright, so for dental caries, you're going to remove the debris with a spoon excavator, flush with water, isolate with cotton rolls, and then they like to use this temp filling here. Zinc oxide eugenol is what's usually on the test. Okay, so what it's basically saying, so I'm making it around Barney style. I talked about that there's decay in the tooth. So all I do is just take a spoon, scoop out the decay, irrigate it out, clean it up, put a temp filling in there, and then they bring them back to the appointment for the next day, and then they put in an actual filling with either amalgam or composite. Does that make sense? They patch it up, bring them in the next day, and then they'll do a full-on restoration. Okay, acute pulpitis. Okay, we already know. What is itis? Inflammation. Okay, pulp. So acute pulpitis is inflammation of the pulp. All right. Due to dental caries or trauma, increased pain when lying down. That is what they're going to throw on the test. That's what I want you to associate with that. Increased pain when lying down is a symptom of what dental disease? Acute pulpitis. Okay. Now, this one, because it's some sort of inflammation. You're going to remove the debris that's causing the inflammation, right? Otherwise, the inflammation is still going to stay there. Dry with cotton pellets. You're going to have slightly moistened eugenol and return to the DTF the next day. Okay? Eugenol on that one's going to be like a liquid substance to kind of just like bring down some pain in that area where they can actually go in the next day and treat it with either. It can go into, it can go to a bunch of different things. Don't go down to a rabbit hole. But acute pulpitis can turn into a lot of endo work, a lot of cross work. Basically, at this point, they're trying to save the tooth. Because the pulp is what again? The life of the tooth, the pain center. You lose the pulp, you lose the tooth. You lose the tooth. So when there's something wrong with the pulp, they're trying to do anything they can to keep it viable. Sorry, my team's just logged out here. I'm cheap, and I just use the guest teams, and after an hour every time, it logs out. I don't know. In the military, I should get teams for free. Alright, I'm getting my guys back in here now. Now they can all hear me, see the recording. Okay, so, same for anything with a pulp, we want to keep it viable. Once we lose that viability of that pulp, that tooth is of no use, and we're going to extract that tooth. Okay, periapical abscess. What did I say about that? What is that? Yes, pushes the tooth out, right? So, as I explained it before, it's just a little abscess that is literally just, it doesn't have any room to go besides down, and it pushes that tooth there to where your patient...
This is a grape.
Say what?
This is a grape. Looks like a grape.
Looks like a grape, and the patient complains that the tooth feels high because the tooth is literally being forced out of the socket.
When you do that, that's what confuses me, because I keep wanting to think about my bottom teeth, so when you like pull down like that, I'm like...
Well, the tooth can come up too. Sorry, I'm just explaining the maxillaries. So on the mandible down here, same thing. It would just push it up. Okay? So if it's on the apex down here, your tooth is still going to feel high. It's just going to feel high on the bottom instead of the top. Does that make sense? On the top, it's going to push it down. The bottom's going to push it up. Either way, your teeth aren't... Alright, make it make sense. Occlusion. What was occlusion again? Teeth? It's the way they meet together, right? So if one of your teeth feels off, it's not going to have the right occlusion. It's going to feel high either on the top or the bottom. And usually dealing with your periapical abscess. Okay, now this one, they like to talk about the treatment here. Just know, with any kind of abscess, what are you always trying to do with it?
Drain it.
Drain it. Okay? And then excavate, and then we also want to, they like this one here, rinsing with salt water, 10 minutes every 2 hours. I would put a big star next to this one. This is one of those ones they like to fuck with you on the test. So I would know about the salt water, I would know about the time frame, and knowing about draining the abscess. And that there's a grape on the x-ray, and that the patient feels like it's high when they bite. They ask so many questions about this disease right here.
You said it makes it feel hot or high?
High. Does that make sense? I was trying to give you a visual with that. All right, next slide. Yeah.
So when you get a root canal, what is it doing to the pulp?
So root canal, what they're doing is they're trying to clean out the pulp to make sure there's no bacteria or inflammation in there anymore. And then they'll put in like not to nerd out, but they put like gutta percha points or paper points in there to kind of keep it viable. And then if that pulp is not going to survive, because endo is usually a long procedure if you ever notice. They go in and test the vitality of it and see everything's going. If they see there's no vitality left in it, then they know they're going to extract that tooth. Does that make sense? Ready for the next slide? All right. Marginal gingivitis. Hold on now. What was periodontitis again? What was the big key point about that one?
Most common.
Most chronic disease known to mankind. Marginal gingivitis was the most common form of periodontal disease. Right? I say that because that's how you're going to mess you up on the test. Most prevalent disease known to mankind. Most common periodontal disease. Yes. All right. Inflammation, itis, inflammation of the gingival tissue. Rinse with warm water. So the other one was salt water, right? So this one's normal saline. Okay, this one, as I said, is always on the test. If you miss this, I kind of want to slap you in the face because nug and trench mouth, two of the same thing. Those that have been in a while and have been to Afghanistan or stuff like that, trench mouth is very common. Afghanis are horrible at taking care of their teeth, and you would experience seeing that a lot in the field of it. Okay, this one here. We like to talk about this definition here. Progressive loss of the alveolar bone. Okay, so that was the thing I was trying to help you out because there's a lot of words that sound very similar, right? You have pericornitis, periodontitis, gingivitis, right? Gingiva, gums. Anything's dealing with the gums. Dont, I would relate with bone, right? So this is alveolar bone. Is involved with periodontitis. Okay? Pecorn, I'm trying to remember that one. I think we'll go over it in a minute. Yeah, we will. Okay. So I know alveolar bone for periodontitis, and it's the same treatment as marginal gingivitis. Okay? Abscess, what are we always trying to do? Drain. So you poke it with a scaler and let it drain out. That's what it's basically saying. Pericornitis. This is what you need to relate it with every single time. Partially erupted tooth. Okay? I've seen it once on the exam, and I think it was a weird way to ask it. They asked what you label it as. It's pecorn. Okay? Anitis, so southern inflammation around the partially erupted tooth. Red pus. Okay? You're going to irrigate the flap. Clean with the scaler, patient rinse every 2 hours, and dental officer determines antibiotics. Okay? Other oral diseases. Okay? What was the canker sore one? Yep, aptus stomatitis. Okay, and which HPV1 is what? Oral. Type 2 is what? Okay. Post-extraction hemorrhage. This one they throw on the test too. All right. All it is what is a hemorrhage?
Bleed.
Bleed. Post-extraction. What's an extraction?
You take the tooth out.
So it's heavy bleeding from an extraction site. Okay. Know the treatment here because they love to talk about extractions on the test. Note the treatment is the packed site with moistened sterile gauze. Okay. Now what they're trying to do is just stop the bleeding, stop the area. That's why they give you like 15 pieces of gauze when you leave dental if you ever get an extraction. Now, before we go to it, because I want to see if you can guess it, what can happen if that area gets really dry? What's that? Dry socket. Which is right here. Yep. Dry socket following the removal of molars. You're into saline and you're going to loosely pack it. So this is the term I want you to know up here because this has not been mentioned on any of the other ones. Iodoform gauze. So you learned about zinc eugenol, you learned about normal saline, you learned about salt water, and now you learned about iodoform gauze. If I was studying dental and I didn't know dental very well, I'd probably put stars next to those words in each of them so I can click when I see it on the test. Now the fractured teeth I'm about to break down for you too, because this is an easy way to do this. Okay? Alright, so you got 4 pictures here. Type 1, enamel fracture. Okay? So that's literally just a small part of the tooth you can see. Is an enamel fracture. Type 2 is enamel and dentin. So it's going more into the actual largest part of the tooth, right? Dentin. It's more bigger part of that tooth, right? Enamel dentin with pulp exposure is type 3. Okay? Type 4 is enamel dentin and root exposure. So, enamel dentin pulp, enamel dentin pulp root. Does that make sense?
Yep. Just progressively gets worse.
The types of fractures. So you hear about a type 1 fracture and a type 2 fracture. That's how they're going to put it on the test.
Okay.
What is a type 2 fracture or a type 1 fracture? So just knowing that it goes enamel dentin pulp, enamel dentin pulp root can help you know the type 1 through 4.
If I'm asking a question where I was like, the tooth is intact but the root is fractured, what is that classified as?
Well, the only thing that says root fracture is what?
Type 4.
But I know what you're talking about. That's going to be on one of these slides. It's talking about a splint. So, because it's one of these slides where you have to fracture and you have to figure out how you're going to stabilize it if the root is gone. So, it's actually this next slide. This one is on the test too. I know that some of y'all have seen it. Okay, so this is fracture tooth treatments. Okay, type 1 was what kind of fracture? Enamel. Okay, you chipped off part of the little tiny part of your tip of your tooth, right? Smooth out the edges, right? So you don't have any sharp edges poking anything. Okay, dry with cotton rolls, apply cavity varnish, right? And then they're eventually going to put a restoration on that tooth. Okay, that way that your tooth has normal occlusion. Type 2 was what kind of fracture? Enamel and dentin. So for a type 2 fracture, this is what you're doing. You're going to isolate the area with cotton rolls, dry the tooth, zinc oxide and eugenol paste. This again, materials, what you need to know for these. Zinc oxide and eugenol paste for a type 2 fracture. Instruct the patient to eat a bland diet. Okay, and then eventually they're going to have a temporary plastic crown to cover the fracture. Because you lost a lot of structure of that tooth, they're going to have to put a crown in that area. Somebody know what a crown is?
Like a cover.
Yeah, it's like a coverage for the teeth.
Is what they call caps?
Yeah, caps. Caps is another term for it. But basically, like I said, your tooth, you only get one set of teeth. But they want to make sure you still have occlusion, so they're going to put a crown or a cap as a covering there so that you can maintain that normal occlusion.
Is it silver?
Sometimes it's silver, sometimes it's white.
On type 4.
They try to match your tooth color when they're making these.
So you can't go gold one?
And
I'm gonna put gold.
but there's a reason why, and I think they're actually getting away from it. We do amalgam in the back of the mouth, do composite in the front of the mouth. This is my Hollywood smile, but nobody else sees the back. Most of the time when we do restorations, you'll have metal in the back and tooth-colored fillings up front. All right, type 3. What kind of fracture was that?
Type 3 is when it's affecting the pulp as well as the dentin and enamel.
Yes. Okay, this is the splint it's talking about. Place crown form over affected tooth. You see C-type 2 treatment, right? So
Same thing.
don't get confused without reading it. It's basically saying you're still doing zinc oxide and eugenol on the type 3s. Okay? You're making a splint for the teeth here. Okay? So over the affected tooth, and if not enough tooth for the crown. So when we were talking about they lost basically the root, right? And there's nothing to hold it in place, they're going to create a splint that keeps that tooth in place. See if they can still save that tooth. That makes sense? So if that tooth is out of the mouth, can't get back. Alright? Type 4. Okay, usually all these are treated by a dental officer. But type 4, treated by your dental officer. If not, you're going to splint like type 3. Type 4, you're pretty much screwed. But you'll see a lot of these. It might have been Greenside. I actually had a couple sick calls like this. Marines like to fight. And some of that, I saw one where his tooth was completely turned. When he came in, Marines are also, I don't have any Marines in here, right? Some of them are pretty dumb. So when they jump out of buses and they have guns and they're holding their gun like this, break their teeth by the buttstock, smack them in the mouth. This is my favorite term that nobody knows. What bandage is this?
Barton bandage.
Barton bandage. Barton bandage. I have a lot of dental techs that don't even know that. Okay? You use a Barton bandage for a fracture of the mandible or maxilla. Basically a wrap around the head that keeps the jaw together.
Is that named after Clara?
I have no idea who's named after it.
Can you say that statement again?
Barton bandage is for fractures of the mandible and the maxilla. So your jaw. This is the last dental chapter, so you guys can celebrate after this. Alright, and then this one, I don't want to skip over it because it has been on there. Traumatically extracted teeth. HM1 rinse tooth with saline and place back into the socket. Well, it's just like any other vital organ. You have a time frame to get that back in before it's not going to be able to go back. Right?
Well, what's the point of putting it back in if it's not going to stay?
You might get lucky and it does. Depending on how it got extracted out of there. That's why I said I relate it to what you've seen like Grey's Anatomy. They're like, oh, they got their foot. Well, we need to get their foot back on within this time period or it's not going to be viable to get back on their body. Alright, any questions about dental?